Hello everyone, this is Dr. Sam and this video is about carotid artery ultrasound reporting. You will learn how to write ultrasound reports for different carotid artery pathologies. The reports will mainly include the findings and the impression. This is a normal carotid artery ultrasound report example. In this example, the clinical indication is evaluation of carotid artery for patients complained of intermittent dizziness. These are the findings of the right carotid artery. The first section is the common carotid artery, which is the right common carotid artery. No evidence of plaque. The peak systolic velocity is 80 centimeters per second. And for the right internal carotid artery, no evidence of plaque as well. The PSV is 90 centimeters per second. So these are normal findings. In the right external carotid artery, there is no evidence of plaque. The PSV is 75 centimeters per second. Visualized segments of the vertebral artery were patent. Next, we have the findings of the left carotid artery, which starts with the left common carotid artery. There was no evidence of plaque as well, and the PSV was 78 centimeters per second. And for the internal carotid artery, no plaque was seen as well. The PSV was 88 centimeters per second. The left external carotid artery is also normal, and the visualized segments of the vertebral artery were patent. And here is the impression. No evidence of significant stenosis or plaque formation. In the visualized portions of the right and left carotid arteries, normal flow velocities in the common, internal and external carotid arteries bilaterally. No evidence of hemodynamically significant stenosis. And you can end the impression with writing this line: no further imaging is recommended at this time. Clinical correlation is suggested, and follow up with the referring physician for any additional concerns or symptoms is advised. Now we will look at stenosis, starting with an internal carotid artery stenosis between 0 and 49%. In this case example, the clinical indication is evaluation of carotid artery for a history of transient ischemic attack. Now we have the findings in the right carotid artery. In the right common carotid artery, there is no evidence of plaque. The peak systolic velocity is 78 centimeters per second. These are the findings in the right internal carotid artery. Atherosclerotic plaque identified, causing approximately 30% stenosis. The PSV is 105 centimeters per second. The end diastolic velocity is 40 centimeters per second. The external carotid artery and the visualized segments of the vertebral artery were normal. On the left side, the common carotid artery and the internal carotid artery were normal. The left external carotid artery as well as the visualized part of the vertebral artery were also normal. This is the impression. Approximately 30% stenosis of the right internal carotid artery due to atherosclerotic plaque. No hemodynamically significant stenosis. No evidence of significant stenosis or plaque formation in the visualized portions of the left carotid artery. Normal flow velocities in the common and external carotid arteries bilaterally. Regular clinical follow-up and risk factor management is advised. Repeat imaging in 12 to 24 months or sooner if there is a change in clinical symptoms is recommended. This is a report for 50 to 69% ICA stenosis. The clinical indication is evaluation of carotid artery due to a history of transient ischemic attack. These are the findings in the right carotid artery. The common carotid artery is normal, but in the internal carotid artery, atherosclerotic plaque causing luminal narrowing with an estimated 50 to 69% stenosis, PSV approximately 275 centimeters per second, and diastolic velocity 65 centimeters per second. The external carotid artery and the vertebral artery were normal. These are the findings in the left carotid artery. Mild atherosclerotic changes without significant stenosis. In the left external carotid artery, mild atherosclerotic changes without significant stenosis are noted. The PSV is 75 centimeters per second, and the visualized segment of vertebral artery is normal. This is the impression. 50 to 69% stenosis of the right internal carotid artery due to atherosclerotic plaque. Hemodynamic changes with a PSV of approximately 275 centimeters per second and EDV of 65 centimeters per second are consistent with this degree of stenosis. Mild atherosclerotic changes in the left common and external carotid arteries without hemodynamically significant stenosis. No evidence of significant stenosis in the visualized portions of the left ICA. Considering the degree of stenosis in the right ICA, a referral to a vascular surgeon for further evaluation and potential intervention is suggested. Aggressive risk factor management and medical therapy should be emphasized. Now we move on to a greater than 70% ICA stenosis but less than near occlusion. In this example, the clinical indication is evaluation of carotid arteries due to intermittent dizziness and vertigo. In the right common carotid artery, mild atherosclerotic changes without significant stenosis are seen. Peak systolic velocity 90 centimeters per second. In the internal carotid artery, significant atherosclerotic plaque identified causing luminal narrowing, estimated to be greater than 70% stenosis but less than near occlusion. PSV approximately 400 centimeters per second and diastolic velocity approximately 100 centimeters per second. The external carotid artery and the visualized part of vertebral artery were normal. The left side was unremarkable. The common carotid, internal carotid, and external carotid arteries were normal. And here is the impression. Greater than 70% stenosis of the right internal carotid artery, but less than near occlusion due to atherosclerotic plaque. The hemodynamic changes with a PSV of approximately 400 centimeters per second and EDV of approximately 100 centimeters per second are consistent with this degree of stenosis. No evidence of significant stenosis or plaque formation in the visualized portions of the left carotid artery. Mild atherosclerotic changes in the right common carotid artery without significant stenosis. Due to elevated velocities and significant stenosis in the right ICA, an urgent consultation with a vascular surgeon for evaluation and potential intervention is strongly advised. Risk factor management and appropriate medical therapy should be initiated promptly. This report is of near occlusion. The clinical indication is persistent headaches and recent visual disturbances. Here are the findings in the right carotid artery. In the common carotid artery, minimal atherosclerotic changes without significant stenosis were noted. Peak systolic velocity 89 centimeters per second. The internal carotid artery has dramatic lumen narrowing consistent with near occlusion. The flow in the ICA was significantly reduced and appeared sluggish on color Doppler. Direct measurement of PSV was challenging due to diminished flow and velocities were substantially decreased. The rest of the right side was normal. In the left internal carotid artery, mild atherosclerotic changes without significant stenosis were noted. PSV 94 centimeters per second. The left external carotid artery was unremarkable. We have the impression here. Near occlusion of the right internal carotid artery with markedly reduced flow and significant lumen narrowing. Given the extremely diminished flow, accurate Doppler velocity measurements were difficult. Mild atherosclerotic changes in the left ICA without hemodynamically significant stenosis. No significant findings in the left and right ECA. Given the findings suggestive of near occlusion in the right ICA, an urgent consultation with a vascular surgeon is strongly recommended. Immediate risk factor management, medical therapy, and potential surgical intervention should be considered. This is a case of total ICA occlusion. The indication is recent episodes of transient visual loss in the left eye. In the right internal carotid artery, total occlusion observed, no flow detected on color or spectral Doppler. For the external carotid artery, minimal atherosclerotic changes without significant stenosis are observed. PSV 78 centimeters per second. The visualized segments of vertebral artery were patent. Mild atherosclerotic changes without significant stenosis were observed in the left common carotid artery, and the left internal carotid artery was normal. The left external carotid artery was also unremarkable. This is the impression: total occlusion of the right internal carotid artery with no detectable flow, mild atherosclerotic changes in the left common carotid artery without hemodynamically significant stenosis, no significant findings in the left ICA or both ECAs. In light of total occlusion in the right ICA, urgent consultation with a vascular surgeon and neurologist is paramount. Comprehensive risk factor management, medical therapy, and potential surgical intervention or alternative therapies should be assessed promptly. Here is a report for common carotid artery dissection. Clinical indication is evaluation of carotid artery due to neck pain following minor trauma and suspected vascular pathology. These are the findings. In the right common carotid artery, dissection observed, characterized by an intimal flap and a false lumen. The true lumen appears partially compressed, but some flow is still evident on color Doppler. No intramural hematoma visualized. The right internal and external carotid arteries were unremarkable. Minimal atherosclerotic changes without significant stenosis were observed in the left internal carotid artery. The left external carotid artery was unremarkable. Here is the impression: dissection of right common carotid artery with presence of an intimal flap and a false lumen. No significant findings in the left common carotid artery, both internal carotid arteries, or both external carotid arteries. Considering the observed dissection in the right CCA, urgent evaluation and management by a vascular surgeon or interventional radiologist is strongly recommended. The patient should be monitored for potential complications and might benefit from antithrombotic therapy, but the decision should be based on clinical findings and further imaging results. This report is based on the evaluation of a normal common carotid artery stent. The indication is a routine follow-up of a previously stented right common carotid artery. Here are the findings for the right carotid artery. Common carotid artery, patent stent visualized with no evidence of in-stent restenosis. Flow within the stent is unobstructed on color Doppler with a peak systolic velocity of 88 centimeters per second. Internal carotid artery, no evidence of plaque or stenosis. PSV 92 centimeters per second. The right external carotid artery was unremarkable. The left carotid artery was also unremarkable. This is the impression: patent right common carotid artery stent with no evidence of in-stent restenosis or occlusion. No significant findings in the left carotid system or the right ICA and ECA. No immediate intervention required. Routine follow-up imaging in 12 months to monitor the patency of the stent is advised unless clinical symptoms suggest otherwise. This is a case of CCA Stent recurrent stenosis. Indication is follow-up of a previously stented right common carotid artery due to recent transient ischemic attack symptoms. The stent within the right common carotid artery shows evidence of recurrent stenosis. Color Doppler reveals turbulent flow, and spectral Doppler shows a PSV of 300 centimeters per second, consistent with significant stenosis. The right ICA and ECA were unremarkable. Mild atherosclerotic changes without significant stenosis were seen in the left common carotid artery and the left internal carotid artery. This is the impression. Recurrent stenosis within the right common carotid artery stent with hemodynamically significant velocities consistent with severe stenosis. No significant stenosis or plaque within the right ICA and ECA or the left carotid system. Given the observed recurrent stenosis within the stented region of the right CCA, immediate evaluation by a vascular surgeon or interventional radiologist is strongly recommended. Consideration for angioplasty or other interventions might be necessary based on the clinical scenario and additional imaging. Now we have a case of common carotid artery aneurysm. In this example, the right carotid artery and its branches were unremarkable. In the left common carotid artery, an aneurysmal dilation measuring approximately 2.5 centimeters in diameter is observed. The vessel walls appear intact with no evidence of rupture. Color Doppler reveals turbulent flow within the aneurysm sac. PSV in the proximal CCA is 86 centimeters per second, while within the aneurysm it is reduced to 50 centimeters per second. The left internal and external carotid arteries were normal. This is the impression. Aneurysmal dilation of the left common carotid artery measuring approximately 2.5 centimeters. No significant findings in the right carotid system or left ICA and ECA. The observed aneurysm in the left CCA warrants urgent consultation with a vascular surgeon. Further imaging such as CT angiogram or MR angiogram might be helpful for better characterization and to plan potential surgical or endovascular interventions. Here is a report for CCA Pseudoaneurysm. Clinical indication is evaluation of a soft pulsatile mass in the right neck region following a recent catheter-based procedure. This is a report regarding pseudoaneurysm. These are the findings of the right common carotid artery. A saccular outpouching consistent with a pseudoaneurysm is observed, measuring approximately 1.7 centimeters in diameter. Color Doppler demonstrates the classic to and fro pattern indicative of a pseudoaneurysm. Peak systolic velocity in the proximal CCA is 85 centimeters per second, while within the neck of the pseudoaneurysm, it is markedly increased to 175 centimeters per second. The right internal and external carotid arteries were unremarkable. The left carotid artery was also unremarkable. This is the impression pseudoaneurysm of the right common carotid artery, likely post-procedural, measuring approximately 1.7 centimeters. No significant findings in the left carotid system or the right ICA and ECA. The observed pseudoaneurysm in the right CCA requires immediate attention. Consultation with a vascular surgeon or interventional radiologist is strongly recommended. Consideration for ultrasound-guided compression, thrombin injection, or surgical intervention might be necessary based on the clinical scenario and the size and location of the pseudoaneurysm. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.